Winter is here, the days are shorter, the weather is colder. Do you really need to keep wearing your sunscreen? And do you need to stop using your retinoids? I'm Dr. Mina. Let's discuss. Welcome to my channel, The Skin Row, where I give real people real information so that they can make informed and educated decisions about their skin health. Sound good? Let's get into it. This is my weekly recap episode where I break down my key takeaways from my most recent interview with Dr. Marisa Garshick. In this episode, we talked about how to winterize your skin and what things you should be doing and what things you maybe should avoid during these colder winter months. If you want to hear the full episode, I highly recommend stick around to the end where I will be linking the video after this one. All right, so this is a question I get asked all the time from my patients and friends, and honestly, even wherever I am, about what do I really need to do in the wintertime? Do I really need to change up my skincare? Do I need to mix things up? The short answer is if things are working for you and you're happy with how your skin is, then stay the course. You don't have to change things up. But if you live somewhere where it's very cold and there is a lot of dry air from all the indoor heating, then you may notice that your skin is a little bit tighter. It's a little bit flakier. It maybe looks a little dull and lackluster. Then you may want to consider changing up your skincare just a little bit in the winter. So here's what I'd recommend. The main thing is you don't need to go crazy. You don't need to throw out everything. You don't have to change things up. But there are a few modifications you may want to make to help increase hydration and moisture in your skin, especially if it's feeling tight, cracked, chapped, all of that stuff, which at least for me, that can happen in the winter months. So number one would be to think about your cleanser. And you may want to opt for a creamier cleanser or a cleanser that's formulated for dry skin, even if you normally don't have dry skin. So you may be able to handle a lighter cleanser in the spring and summer, but in the winter, a creamier, more hydrating cleanser might be more beneficial for you. That's number one. Number two would be think about the moisturizer that you're using. In the summertime, sometimes I don't even use moisturizer because my sunscreen is pretty moisturizing. But in the wintertime, I pretty much always have a moisturizer on board because my skin is drier. So in the spring and summer, you may be using more of a lotion, something that's very thin and lighter, but you may want to opt for something thicker and creamier, maybe something in a tub that you can use when the weather is colder and drier. So that's something you may want to also mix up as well. Winter is also a great time to use petrolatum based products, things like Vaseline, Aquaphor, Cream has a healing ointment, CeraVe has a healing ointment. Those thick ointments are going to be super, super hydrating. So some of the places I like to use it around my eyes tend to get really dry. My cuticles, my fingers, my heels sometimes get cracked. My lips, of course, right? Chapped lips. This is common, very common in the winter. So this is like a staple in my skincare routine in the winter months. And I will give my children like a little packet of Aquaphor to put in their pocket so that they can take it to school because I notice their lips are getting pretty dry or their hands are getting really dry. Now, these ointments can be very sticky and heavy feeling. So I've got a couple tips for you there. The best time to apply this is when your skin is a little damp. Then it will draw in that moisture better and lock it in, and it won't feel like it's just sitting on top of your skin, thick and sticky. My other tip is to try, I love Aquaphor spray. It goes on really lightly and you can rub it on like your legs, your arms, your children, wherever you need a lot of coverage and a lot of thick coverage, but it doesn't give that heavy thickness that if you were to just scoop it out of the tub. So I love the spray and I love those little mini ones that you can put in your coat, your purse, on the go, especially for those chapped lips. Number three, do you need sunscreen in the winter? I think unanimously most dermatologists are going to say yes. And I think people underestimate the amount of sun they get. Yes, in the winter months, especially if you live in northern altitudes, you may not see much sun. But chances are you're getting some sun walking to and from the car. Maybe you sit next to a window. Maybe you decide to pop out for lunch somewhere. So I think it's good just to have it in case. You never know what's going to unfold in your day. And then also, it's just important to keep it as a habit. If you only wear it certain months or certain days, then you're more apt to forget it the times that you really need it. So in my book, it's just a good idea to keep it by your toothbrush. You always brush your teeth every day. So go ahead and have that sunscreen there and just put it on, make it habitual, make it a must have, even in the winter months that you just always put it on. So I strongly believe you still need to use your sunscreen. Now, what about actives? I get a lot of questions like in the winter, my skin's too dry. I need to stop all my actives. So, vitamin C, you actually can still keep using, and you can even keep using your retinoids and your retinols. A couple caveats though, you may want to decrease the frequency. So, if you are used to using it every night or every other night, you may want to just use it 2 or 3 nights a week. You may also want to bump down the concentration. So you don't have to stay at the highest concentration or wherever you are. You actually can bump it down. If you're on a prescription strength, you may want to lower that. If you can't go any lower, try something like adapalene that's over the counter. That's a little bit less strong. So again, it's all about maintaining these good habits. So I would encourage you to still stick with using your retinol or retinoid in the winter. Just modify it, lower the concentration, lower the frequency. And then I do the sandwich technique. So I wash my face, I put on a moisturizer, then I put on my tretinoin, and then I follow up with any slugging around my eyes, lips, or any area that tends to get really dry. I'll put on a little extra with some petrolatum-based product there. So those are some tips to still be able to use your retinols or your retinoids. You do not have to stop them in the winter. In fact, I think it's best to continue using them, but just make some modifications. Some things you should avoid in the winter are really hot showers, especially long hot showers. I know it feels good, but it really can dry your skin out. So that is something, especially if you are prone to really dry skin, you may want to back off on those. Your skin will thank you. And then as soon as you get out of that shower, slap on your moisturizer because that's the time it's going to absorb the best. If your children have really dry skin, don't be afraid of washing them or bathing them. In fact, the water on their skin is actually very hydrating, but you want to be careful that you are only using a gentle cleanser. You may want to just wash the areas like the armpits, the groin, and the bottom of the feet with a gentle cleanser and not use the cleanser on the rest of the body. And then, of course, lock in that moisture as soon as they get out. Are there certain cosmetic procedures that we should do in the winter or maybe avoid? I would say really there's nothing you have to avoid. And wintertime is actually a great time to do some cosmetic procedures like resurfacing lasers, chemical peels, laser hair removals, removing all that sun damage or brown spots from the summer. This is a great time to do it. In general, people aren't tan, people aren't out in the sun as much. So this is a great time to kind of undo that sun damage and to do those maybe bigger procedures that have a little more downtime. I find that winter is very popular for these things, chemical peels as well. So this is a busy season, at least in my office, for people looking to have these sort of treatments. And there's really nothing I can think of that you need to avoid in the wintertime. I just wouldn't recommend having a procedure if your skin barrier is compromised. You want to make sure your skin barrier is good, you don't have any rashes or dry skin or irritation before embarking on a procedure like this. So, do you need to winterize your skincare? Well, hopefully, this is giving you a few tips on ways that you can make subtle little changes to your skincare to increase your skin's hydration, to make sure that it is still healthy, not dry, not cracked, but you don't have to totally change things up and throw things out or totally omit stuff. Hope this episode was helpful. If you want to hear the full episode with Dr. Garshick, I will link it right here, and I will see you next week.